talking to Live at 5. A nationwide study says females are more likely to suffer from broken heart syndrome than men. The syndrome is when a prolonged stress causes overwhelming heart attack-like symptoms. Dr. David Jones is a cardiologist with Baptist Health, and he's here to talk more about it. Good to see you.
Thanks for having me.
Yeah, tell us what this syndrome is exactly.
Well, it's a sudden and usually reversible weakening of the heart muscle that usually goes with a stressor or some kind of acute anxiety and stress in someone's life. The classic syndrome is the wife who loses her husband and has what most people say an anxiety attack, but often will have other symptoms that go with it.
Right. So how serious is it? You say that it's reversible.
It usually is reversible. It usually does get better. People present with chest pain, shortness of breath, heart failure, abnormal heart rhythms, and can, for all intents and purposes, look like they're having a heart attack or some severe heart failure. And we diagnose it with an angiogram, meaning that there are no blocked arteries that cause that, and it usually will get better over as the stress gets better.
So have you seen much of this in your practice?
We have. We see it quite a bit, actually. The literature says 2% of all heart attack symptom patients, so chest pain patients, will have this broken heart syndrome, and so we see it quite frequently.
What is done to treat it exactly?
Usually you just give the medicines that we use for heart failure, beta blockers and ACE inhibitors, and we put a patient in bed until their symptoms get better. Occasionally we'll have to use diuretics, which are fluid pills to get rid of excess fluid, but it's the standard treatment for heart patients, and then time.
Well, this study has shown that it is more prevalent in women. Was that surprising for you at all to hear that? It's
not surprising at all. It will be very interesting as time goes to figure out exactly why women are more likely. We have several guesses now, and one of them has to do with hormones. Postmenopausal women have a change in their hormone situation, and then the other thought is that it is an adrenaline-mediated reaction, and so men are thought to maybe have more adrenaline receptors on their heart cells, and women have fewer receptors for adrenaline, and so the adrenaline can overwhelm a woman's heart and cause it to weaken transiently, temporarily.
Well, I can't imagine what you could do to kind of prepare for something like that, but there are ways that you can live your life that will, in general, make your heart healthier overall, wouldn't you say? Absolutely,
absolutely. The incidence of women who have high anxiety, though, have a higher incidence of this broken heart syndrome, and so what we often say to people is you try to avoid the anxiety attacks and anxious moments, stressful moments.
Right. Okay, very interesting. Thanks, Doctor, for coming on today. We appreciate it.
Thanks for having me.